Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. I'm pleased to provide an update on the COVID-19 pandemic for Tennessee, Virginia, and the Appalachian Highlands for August 23rd, 2020. We talk about wanting to see a mature pandemic. That's what we're seeing in Belgium and other European countries, where the numbers went up and then the total number of deaths seems to be leveling off. And again, we see this in most of the most impacted countries. These are the four most impacted countries in Europe. And even though the number of deaths differs in each country, the pattern seems to be quite the same. Another way of looking at it is the percent change from week to week. Early on, Belgium was doubling their numbers, more than 100% growth in a single week. But then it's been down very, very low now for several months at about 0.5%. Overall, the U.S. seems to be leveling off just below 5%. So let's look at Virginia and Tennessee. Virginia has also come down, seems to be leveling off. It bounced around a little bit, but now seems to be leveling off about where the U.S. is as well. If you look at total cases in Virginia, they rose slowly, then dropped and came back up, and now seem to be coming back down again. As mentioned, I prefer to follow deaths. And this is kind of interesting because what you see in Virginia is an early spike in deaths. It dropped, it came back up, it dropped, it came back up, and came back down again. And I think the way to think about that is as the pandemic spread within Virginia, it hit different metropolitan areas, different population segments, and it would cause increased number of deaths in those segments. These are two maps. I'm going to superimpose them. This is all of the cases in Virginia since the beginning. And now I'm going to superimpose on it the last 2 weeks. And what you can see is the dark areas, particularly in the rural areas and in our region in the West as well. So again, what you're seeing is from what was originally largely isolated in the most urban areas is now spreading into other parts of the state. In Tennessee, we're not seeing quite the same pattern. We are seeing a drop, but unfortunately, it now seems to be leveling off between 10 and 15%, which means every week we have 10 to 15% more deaths than we had the week before. So it's still not a maturing epidemic. Historically, we were very slow to increase our number of cases, and it leveled off and started coming back down. Again, as I say many times, I'm not a big fan of using cases because cases are dependent on how many tests you run. I much more prefer to look at deaths. And what you can see in Tennessee is we've just had a steady increase in the number of deaths per day. If you superimpose this map of all of the cases in Tennessee, this is since the beginning, you can see they were largely clustered in our urban areas. But now I updated with the cases just in the past 2 weeks, and you can see a real spread in our rural areas. And this is sort of consistent with the idea that the pandemic enters one part of the state, often in a metropolitan area. You see a spike in the number of deaths, and then it spreads out into other areas. In Appalachian Highlands, what you can see is this is hospitalizations in red and new cases in blue. This is from Dr. Mann's site. And what you can see is they pretty much paralleled each other until about a month or so ago, and they split. So the question is, why would we still be having hospitalizations but no cases? Is it because people are sicker? Possibly. But much more likely, we're just simply not conducting as many tests. This reinforces the importance of looking at something other than cases if you want to follow the pandemic. In terms of confirmed cases in our region, we really started following this in early May. And what you can see is a steady increase in the numbers of cases in our region, such that we've now had 31,000 cases and an 8.8% increase in the past week. If you look at deaths, again, it's been growing steadily from the beginning and then seems to be picking up quite quickly with a 14%. So we've had a greater increase in deaths in the past week in Appalachia than we have in cases. And that, again, is reflective of the fact that we're not doing as many tests, perhaps, as we used to be. And we've seen a doubling in the number of deaths in the past month. Very similar pattern to what we're seeing in Tennessee, perhaps slightly steeper. In Tennessee, we've seen this dropping and slowing of the growth rate down to 10 to 15% per week. But in our region, it seemed to go up, then it came back down, and now seems to be leveling off perhaps, but now between 15 and 20%. So our region is certainly not past its peak. It's still growing. It's growing perhaps a bit more rapidly than it is in the rest of Tennessee, and certainly more rapidly than we're seeing in Virginia. If you look at this map of the 3 states, you can see the darker counties of the cases in the past 2 weeks, and you can certainly see a clustering in Northeast Tennessee and Southwest Virginia. So in terms of total cases, Tennessee's reported 142,000 with 1,500 deaths. Virginia, 112,000, less cases, but more deaths. And our region, 31,000 cases and 485 deaths. One point to point out, 1% of the cases in Tennessee have resulted in deaths, if you will, 2% in Virginia. Does that mean Virginia's healthcare is worse? No. Does it mean that somehow their disease there is worse? Probably not. What it means is that they simply aren't doing as much testing. This is, again, another reason why we have to look at something besides cases. Until we're doing more widespread testing, we really have to look at things like hospitalizations and deaths. So again, we're in the midst of an evolving pandemic. It seems to be in our region right now pretty seriously. Also still in Tennessee across the board, Virginia perhaps getting a little bit better. We'll keep our fingers crossed and hope that we do start reaching a maximum in the near future. But until then, I will be doing these websites and these broadcasts. There's a great deal more information about COVID-19 on our College of Public Health website. If you go to this icon, we'll take you to other videos. If you know anyone who would like to get these weekly updates, please let us know. And certainly if you have any other questions or would like us to cover any other issues, we look forward to hearing from you. Thank you very much.